So after that, I said, okay, for this, I could have for the right side, which was invasive, I could have a lumpectomy and radiotherapy. Is it radiotherapy? Yeah. And then for the left one, he said it was a dead cert, it was a mastectomy. Okay, that's fine. So I went home and I thought, hold on, why would I do a mastectomy here, go through radiotherapy or whatever that is, and having it, you know, the lumpectomy? I said, that's ridiculous, when I could finally read the oomph. So he said I should come back and I should ask him questions. So when I went back, I said, hold on a second, the information that you've given to me, I see you can do immediate reconstruction, but I can only see on one. There isn't anything showing me that you can do both. I said, because that's what I want. I said, because if this is a mastectomy, I cannot see any logic in this being a lumpectomy, and what am I, you know, what's the point? I said, you know, if we're doing that, I would request that I have a bilateral, you know, mastectomy and bilateral reconstruction. And I said, I want it immediately. The reason I want it immediately is that I cannot wake up with a mastectomy and remember that I have cancer. I can't be asked to do that. I want to wake up and I want to feel that nothing has happened. I just want to make sure that my chest is there, whichever way you want to do it, but you know. In the process of reconstruction, if I can remember, because it was a tram flap, so they mark you and everything. They ask you, which is good, what size chest do you want to be? If you're big chested, do you want to go smaller or do you want to go bigger, and all that. And because it's a tram flap, so they were taking my muscles, the tissue from my stomach, in order to recreate my breast. This is something my sister and I decided, because you can also use silicone. But my sister said, you know, if you already had cancer, why are we going to put another alien thing into your that? We didn't, you know. So they had a look at me. I think I had lost quite a bit of weight then. So the surgeon looked at me. I said, you just about have enough muscle or, you know, fat in order to do the reconstruction. So they mark it, they mark where they're going to cut, and, you know, your chest size. So we agreed on the chest size that I would be, and he said, okay, because of your physique, he thinks that this would be the best. I said, but I didn't want anything big or anything, just keep it, you know, proportionate with my body. So we did that, which was fine. So the next day, obviously, then they tell you when to come in for the surgery. So they could do the surgery, you know, they take everything out, put it in your chest, but they actually rewire all your veins, all the blood vessels. So there's a whole lot of rewiring that takes place. The plastic surgeon from St. Thomas's and my breast surgeons had to work as a team, because the breast surgeons took out the cancer and then they took out 17 lymph nodes from my right arm. So they took out all the cancerous things. Then the plastic surgeons go in immediately and then use the tissues and then reconstruct your chest.